Hi, this is Dr. Becca with Del Mar Center for Behavioral Health. This will be a couple-minute video introducing what you can expect when you have an appointment for psychological testing. Psychological testing is a really valuable tool. It can help us gain more information about diagnostic clarity, which basically means to be sure that we have the right label on each individual. This is important because so many symptoms overlap with a variety of different disorders that only a thorough assessment can really give us the best picture. And only when we have the best picture of what an individual's strengths and weaknesses are we able to come up and craft with a really individualized treatment program. Most times families are coming to see us because there's concerns about a skill deficit, so the child's not talking or not meeting certain skills or behaviors as they would expect. And so in addition to identifying the diagnosis, we're really looking at making referrals for what's the best treatment, what will help the child make the greatest gains. And so thorough evaluation is really key. The same thing can be said for more mental health-based evaluations like depression or anxiety. It's all well and good to identify that those things are happening, but what we really want to be doing is focusing on what the child needs to help them get rid of those symptoms and get back to or get to feeling happy and healthy and successful. Typically, there is an interview portion with the parent that can be done via phone or technology, such as a HIPAA compliant or protected video or telemedicine platform. The parent is also welcome to come into the clinic and do an in-person interview. Those can take anywhere from 1 to 2.5 hours, depending on the referral question. You'll also get some electronic requests to complete assessments, and these are oftentimes behavior rating scales about your child that will ask you about his or her behavior now as well as over time. We use Q Global and PAR, which are protected and safe portals that can be used to complete standardized assessments. You'll also get an email with our intake documents, which will have a really thorough social developmental questionnaire, which means it's probably going to be a lot of questions that you've answered many times, but a thorough record review and a thorough history is really imperative to a comprehensive assessment. Then after we get all of that information, which is used to help craft a specific testing battery specific to those questions that you have about your child's growth and development. Then we'll have an appointment where your child will come in. Typically they're held first thing in the morning. We're usually at our best in the morning, and so we want to get testing done during that time. The appointments are usually 9 to 12. Sometimes we finish early, and sometimes there may need to be a second testing appointment depending on what the referral questions are. You're a hugely important member of the treatment team during this process. I may know psychology and our team knows their different areas of expertise, but you really are the expert on your child, and so your input is so important, and we really appreciate you being such an active participant in this process. If you have any questions at any time, please reach out to us directly via phone at 910-378-2501. or via email at info@Del-Mar Behavioral Health. You can also reach us via fax at 910-939-1490. If you have any questions, we look forward to answering them, and we look forward to working together to help you and your family take steps towards your goals. Thanks.